Welcome. This is going to be a law in everyday lives discussion, and it will be about euthanasia or mercy killing. So now in Thailand, euthanasia is still considered as illegal and contrasts to the medical perspective. So let's talk about what is euthanasia. It is a kind of medical treatment, or it is a practice of intentionally ending life to relieve pain and suffering. It is now available in 11 countries, which comes with different restrictions. So there is 4 types of euthanasia, which is first, passive euthanasia, active euthanasia, physician-assisted suicide, and the last one is indirect euthanasia. And the first method, or passive euthanasia, is withholding or withdrawing the treatment, for example by unplugging the life-supporting machines, which this one is already legal according to the Health Act, Section 12. Active euthanasia is by letting the patient take or inject substances specifically to end their life themselves. And physician-assisted suicide is by a doctor aiding a patient in terminating their life upon their request. The last one is indirect euthanasia, is prescription of painkiller that may be fatal in attempt to relieve suffering. So from now on, if we talk about euthanasia, we'll be talk about the active euthanasia, physician-assisted suicide, and the indirect euthanasia only. So we must understand that not that patient's request will be easily approved. So when dealing with the patient's specific request for euthanasia or assisted suicide, doctors must observe the following due care criteria. They must first be satisfied that patient's request is voluntary and well considered. Second, they must be satisfied that the patient's suffering is unbearable with no prospect of improvement. Thirdly, they must inform the patient of his or her situation and further prognosis. Fourth, they must discuss the situation with the patient and come to the joint conclusion that there is no other reasonable solution. Fifth, they must consult at least one other physician with no connection to the case, who must then see the patient and the state in writing that the attending physician has satisfied the due care criteria listed in the 4 points above. And the last one, they must exercise due medical care and attention in terminating the patient's life or assisting in his or her suicide. Only once criteria 1st through 6 have been fulfilled may the physician proceed to perform euthanasia or assist the patient in committing suicide. So up to this point, you may wonder if doctors in Netherlands, for example, will always comply with the request for euthanasia. In Netherlands, no. 2/3 of the requests for euthanasia that are put to doctors are refused. Treatment frequently provide relief, while some patients die of natural cause before a decision has been reached. Doctors are not obliged to comply with requests for euthanasia. And the basic principle underlying the legislation is that patients have no absolute right to euthanasia, and doctors no absolute duty to perform it. Also, the nursing staff are not permitted to perform procedures to terminate life. They may only make limited preparations for the procedure. They may also refuse to be involved in such preparations. So next we're going to talk about why is euthanasia illegal. So it is considered as an intent to harm and to end the other's life and considered as a criminal. But what if the patient themselves have another point of view? Let's consider the case study in England in 1990s. Lillian, a patient, has been in a treatment for several years and suffered in a lot of pain, and she is a palliative patient, which she is never going to get better. She and her kids were begging the doctor to basically end her life and to relieve her from suffering. The doctor, which is Mr. Cox here, decided to do as she asked, as he had known this patient for many years and knew her symptoms very well. So later on, Mr. Cox was accused for murder, and he used doctrine double effect as a defense. So what is doctrine double effect? So it is often impossible to do good to patients without also causing them some harm. Because treatments have some side effects, it may also necessary to do something to a patient which would be harmful and wrong outside the medical context. It is done because it will benefit the patient. The double effect doctrine forbids the achievement of good ends by wrong means, but it permits actions with the double effect, both good and bad, under certain conditions. As a result, Mr. Cox received a suspended sentence. And in the area where euthanasia is not allowed, some patients fast to death. Some have to suffer to death. Research from patients' perspective of dignity, autonomy, and control knows that patients in advanced disease has a certain perspective regarding dignity as an intrinsic quality. We may generally say that quality of life after the treatment affects patients' decision of euthanasia. So, talking about the right to die, according to Oregon's Death with Dignity Act, or DWDA, in 1997, Oregon enacted the Death with Dignity Act, allowing terminally ill Oregonians to end their lives through the voluntary self-administration of a lethal dose of medication, expressly prescribed by a physician for that purpose. The DWDA was a citizen initiative passed twice by Oregon voters. The first time was in a general election in November 1994, when it passed by a margin of 51 to 49%, and an injunction delayed implementation of the act until it was lifted on the October 27 of 1997. In November 1997, a measure was placed on the general election ballot to repeal the DWDA. Voters choose to retain the DWDA by a margin of 60% to 40%. So we're here at the last topic, and to answer the question of the whole video, the answer is I would like to make change to the Section 12 of the Health Act, stated that a person shall have the right to make a living will in writing to refuse the public health service which is provided merely to prolong his or her terminal stage of life, or to make a living will to refuse the service as to cease the severe suffering from illness. The living will under paragraph 1 shall be carried out in accordance with the rules and procedure prescribed in the ministerial regulation. An act done by the public health personnel in compliance with the living will under paragraph 1 shall not be held in offense and shall not be liable to any responsibility whatsoever. So, as we discussed earlier, there is a research found that it involves dignity and quality of life after treatment as well. I personally agree with this. I think we should concern the patient's mental health after receiving treatment. For example, in the movie Me Before You, imagine living for 30 years with the best quality of life that a healthy person could have. And after the motorcycle hit the main actor, he received a good medical treatment but wake up paralyzed. He has to stay in wheelchair for the rest of his life. I think we should be able to choose to accept the quality of life or not accept it. In this case, removing the life-supporting machine doesn't exist. He no longer suffers physically, but he suffers mentally. And receiving money as compensation is not the way out. So it may be fairer to them to be able to choose their own way. So I would like to fix the Section 12 to be fairer by including other type of euthanasia into it as well. Thank you.